Magandang umaga sa inyong lahat at welcome sa isang mabilisang rationalization kung saan ay tatalakayin natin ang mga commonly asked board questions dito sa subject na infant care and feeding. Kaya kung ikaw ay nagbabalak na mag-take ng board exams, nasa tamang channel ka. Simulan na natin.
So ang tanong na sa board exams, which Korotkoff sound represents diastolic pressure in children? Always remember, they're asking for the Korotkoff sound in children. Okay, so ang choices natin, first Korotkoff, second Korotkoff, fourth Korotkoff, or the fifth Korotkoff. What are your answers? Chat box! Ano ang answer natin sa ating first question? Which Korotkoff sound is representative of the diastolic pressure in children? Ang sagot po natin dyan, nako, fourth Korotkoff sound, the answer is pamigay. First pamigay of the day is the fourth Korotkoff sound, which is letter C. Now, mag-refresh po tayo. Ano ba ang Korotkoff sound? Korotkoff sounds are the sounds that the healthcare providers listen to when we are measuring for the blood pressure using the sphygmomanometer. So, ibig sabihin po nito, pag kumukuha tayo ng BP, ito po yung pinapakinggan natin pag nag-check tayo ng kanilang mga vital signs, specifically the blood pressure. So, i-review natin. Ang first Korotkoff sound is usually the basis for the systolic pressure. Tama po ba? Yes. And the first Korotkoff sound is the clear, rhythmic tapping that gradually increases in intensity. Ito po yung unang naririnig natin na sound when we get the blood pressure. Next, yung second Korotkoff sound naman, it changes from a clear tapping to a softer murmuring or swishing sound. Yan po yung second na diastolic, na Korotkoff sound natin. Swishing or murmuring po ang tawag natin sa second Korotkoff. Next, sa third phase naman po, we already hear a louder, a more intense, and a more audible and sharp, crisp tapping sound. And then sa fourth Korotkoff sound po, this is the sound of blood flow that already is starting to fade. So pinaka-intense po yung third natin na Korotkoff sound. And then it dies down into the fourth phase. And then nagiging less audible na siya. And there is also muffling. So ang tanong po in the board exams is in children. So basically, pag children po ang pinag-uusapan natin, basically that's around 3 to 12 years old. So yan po ang basis natin ng diastolic pressure for children, ang fourth Korotkoff sound. Basically, 3 to 12 years old, ang basis po natin ng kanilang diastolic pressure is the fourth Korotkoff sound. And then, pag nandun po tayo sa fifth phase ng ating Korotkoff sound, it is already the complete disappearance of the sound. So usually, 13 to 18 basis na po natin itong fifth Korotkoff sound ng kanilang diastolic pressure. And even with our women, pregnant women, this is our basis for the diastolic pressure. So pamigay po ba ang first question? Yes, I think pamigay lang po ang Korotkoff sounds. Okay. Sige, we go to the next question na po. Which of the following accounts the greatest calories in breast milk? Okay, so ang question po, alin dito ang pinakamay maraming calories na nakikita natin sa breast milk? Okay? So ang answer po dito, may nag-answer ng fats, may nag-answer ng protein. The choices are carbohydrates, cholesterol, fats, and protein. Alright. So the correct answer, everyone, always remember po na ang pinakamaraming calories, kaya nga siya nakakataba, ay ang letter C, fats. Fats po ang pinakamaraming calories sa may component natin sa breast milk. Bakit? Isa-isahin natin yung choices. Yung carbohydrates po, that's only 4 calories per gram. Lagi niyong tatandaan yon, ang carbohydrates po, 4 calories lang po yan per gram. Yung protein naman po, pareho lang din, 4 calories per gram. Pero ang fats po, that's 9 calories per gram. So malaki talaga at mas nakakataba talaga ang fats because it is full of calories. And then for alcohol naman po, kayong mga manginginom dyan, ang alcohol po ay nakakataba din, that's 7 calories per gram. Those are all present in your board exams. Common board exam questions po ang lahat ng mga yan. So make it a point to screenshot para po alam natin yung mga components or calories na nakikita natin sa breast milk or mga nutrients natin. Again, carbohydrates 4, protein 4, fats ang 9, and alcohol is 7. So looks like medyo nalito tayo doon, pero okay lang. Marami pa po tayong pamigay na questions later on. Next question. Where will your room in if the where will you room in the baby if the mother is COVID-19 positive? So ang question naman po dito, yung mother po ay COVID-19 positive. Nako, usong-uso po ito sa ating mga board exams question ngayon. Okay? Kasi COVID-19 ang isa sa mga problema natin during this era. So what is your answer? It can either be A, isolation room, B, neonatal intensive care unit, letter C, pediatric ward, or letter D, same room. I repeat, your question is, ang tanong po natin, saan? Where will you room in if the baby is COVID-19 or the mother is COVID-19 positive? Will you place the mother in the isolation room, in the neonatal intensive care unit, in the pediatric ward, or the same room? Can I see on the chat box your answers? Sige na po. And the correct answer, pamigay daw ang letter D, same room. Correct. The answer, ladies and gentlemen, is pamigay nga talaga. It's letter D, same room. Sa mga sumagot po ng neonatal intensive care unit or isolation room, meron po tayong answer dyan. So bakit po same room natin ilalagay yung ating mga pasyente, the mother and the COVID-19 positive mother and the baby? Now always remember po that if the mother is COVID-19 positive, the baby truly is at risk of contracting the virus. Sir, di ba? At risk of contracting the virus, bakit sila ilalagay sa same room? Now, in such cases, you always have to remember that the baby may be placed in the same room, but in a separate cot or a bassinet. So, hindi po magkatabi si nanay at yung baby to minimize the risk of infection. So, yung baby po, he is placed on a different cot or a different bassinet that is away from the mother, but they are in the same room. Now, this is known to be your temporary separation or rooming in with precautions. At ito po yung isa sa mga guidelines na isinadjust ng World Health Organization. Sir, bakit po same room pa rin sila? Number 1 po, bonding. Importante po ang maternal and child bonding during the neonatal period. Kaya po same room pa rin si mother. Number 2, this will also aid in breastfeeding. Even if the mother is COVID-19 positive, we always have to remember that the baby also has its needs. So dapat po, they are placed on the same room, pero separate yung cot ng mother and the baby. And then, ginagawa din po yung temporary separation so that the mother can also monitor if the baby is still alive, if the baby is uncomfortable, crying. And aside from that, placing the mother and the baby in the same room can also reduce the risks of infection. Bakit? Kasi pag nilagay mo po sa neonatal intensive care unit yung baby, tapos yung mother kailangan niya pong magpa-breastfeed, anong gagawin ng nanay? Aalis pa siya sa room, maglalakad pa siya papunta sa ICU or papunta sa isolation room or pediatric ward, and that will now increase the chances of her spreading the COVID-19 virus. Kaya po hindi na po nilalagay sa isolation room, NICU, or pediatric ward yung ating babies if the mother is COVID-19 positive. Same room na po sila kasi marami pa rin pong benefits ito. And always remember, when you breastfeed the baby, nare-receive niya yung immunoglobulin G that will also protect him against specific viruses and bacteria kasi pang protection din po natin yon. So pamigay po ang number 3 question. Yes, it's a pamigay question. Next. Exciting, di ba? Mas clear na po ba ngayon? Mahahawan si baby ng ibang sakit. Oh, yada, yada, yada. Yes. Okay, next. Fourth question. Game, tignan natin, pulsahan po natin ang ating mga reviewers. This is the most common, highly developed sense of the newborn at birth. Pinaka-developed na senses po ng newborn at birth. And what is our answer? Diyos ko, day, parang lahat pamigay except kay secret. Okay, the correct answer, ladies and gentlemen, for this one is, okay, pulsuhan pa rin po natin. Alright, sige, let's go. Ang correct answer po dito, ladies and gentlemen, is smell. The most developed sense of the newborn at birth is always the smell. Okay? So always remember, the sense of smell is one of the most developed senses in newborn babies. Okay, sir, bakit po? The olfactory system is also one of the first systems to be developed inside the womb of the mother. Ito pong sense of smell natin, olfactory system involving our nose and our mga smell receptors are the first ones to be developed intrauterine. Now, alam nyo ba, merong research na nagsasabi that the newborn can already distinguish the scent of their mother's breast milk from the scent of other mothers. Kaya nga po, very important ang maternal and child bonding, yung ating skin-to-skin contact, para ang unang maamoy ng neonate natin ay yung scent ng mother. Bakit po? Because it also aids in the bonding. Mas nagkakaroon kasi ng familiarity yung baby sa kanyang nanay kapag naaamoy niya ang nanay niya. And also, there is a research study that correlates na magkaamoy daw yung amniotic fluid and the mother's breast milk. Kaya kahit hindi pa nakakakita ng masyado yung baby, ay kaya na niyang hanapin yung source of milk kasi magkaamoy daw ang breast milk, ang colostrum, and yung amniotic fluid. So, it's always safe to say that the sense of smell is the most developed sense of the newborn baby. So, yan po yung lagi nating tatandaan. It's always the sense of smell. So, maganda pong ginagamit natin ang ating mga pasyente, ang knowledge na ito sa ating mga pasyente so that we can promote bonding and we can also establish or initiate breastfeeding. Smell po ang pinaka-developed na sense of the baby. Alright, parang pamigay ulit ang question number 4. Next, number 5. Pulsuhan po natin ang inyong mga sagot. When the mother of the baby is COVID-19 positive, what should she avoid? Number 1, cuddling. Letter B, breastfeeding. Letter C, kissing the baby. Or letter D, bathing the baby. Again, alam ko, pamigay na naman ito, sasampalin ko yung hindi makakasagot nito. Ready na ba kayong masampal? Ay, wala akong sasampalin. Okay? Ladies and gentlemen, the correct answer for this one is letter C, kissing the baby. Always remember po that the virus is spread through oropharyngeal secretions, okay? Or mga secretions natin coming from the nose and the mouth. Kaya nga po pag may COVID-19 yung ating mga pasyente, we always tell them to do respiratory hygiene at mag-mask po sila. And as much as possible, pag magka-cough po sila, ay dito po babahing and then a frequent hand washing kasi nga po nasuspread yon through droplet, nasuspread yun through nasopharyngeal na secretions, at pag humatching ka or bumahing ka sa isang table, ay pwede ding mag-survive doon yung virus. Okay? So, always remember po na pag kinakadal mo yung baby at nakamask ka naman and you did hand washing, nape-prevent natin yung COVID-19 spread. Kaya ang letter A po, hindi yan nakakahawa sa COVID-19 because we have precautions that we can do. Ang breastfeeding po, again, that is also considered one of the necessary things that we should promote even if the mother is COVID-19 positive. Kasi kailangan din po ng baby mag-survive at kumain. Even bathing the baby will also decrease the risks of infection. Ang letter C po ang nakakatakot dyan because there is a risk of transmission of the virus from the mother during delivery. Pag nagko-contact sila with infected bodily fluids, specifically yung mga droplets, yung mga sipon, laway, or through the air if the mother coughs or sneezes. Lalo pag hindi nakamask yung nanay na kinikis-kis niya yung baby niya, ay nako, magkakaroon din ng COVID yung ating newborn baby. So always remember po, letter A, cuddling, letter B, breastfeeding, and letter D, bathing the baby are still doable and permitted po na gawin ng mga nanay niyan kasi naka-same room naman sila. Pero as much as possible, we prevent her from kissing the baby, yung mga yung mga kinakagat-kagat yung baby, because that is already near the nasopharyngeal secretions in case ay mabibigyan niya ng virus yung kanyang anak. Okay?
At dyan na po nagtatapos ang ating mabilisang rationalization session para sa subject na infant care and feeding. Tutok lang kayo kasi part 1 lang to. Susunod na ang part 2.